Hi, I'm Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. She's been keeping us informed throughout the pandemic. Hi, Julie.
Hi, how are you?
I'm doing okay. I want to check in with you on the numbers. Where are we in Champaign County and beyond?
Well, right now we're at a total of 1,649 cases, which just means they're cumulative cases. That's how many we've had since the start. But 153 are active cases with 14 hospitalized, and we've had 19 deaths. So that's where we are. The vast majority of the cases are in younger people, everything from infants all the way up to people in their 30s. So that's a lot of people are definitely continuing, especially older people, continuing to stay home and stay away from people. But so a lot of the cases are people who are out running around.
One of the groups of people that can be spreaders or super spreaders are kids. Are you relieved that we are not doing face-to-face learning in Unit 4 this fall?
Honestly, yes. Just because, there's so many issues with it. Of course, public health, if we could get everyone to stay at home all the time during this, we would do that. So, of course, I'm good to go with that. But I will say we've reviewed all of the plans in Champaign County, and every school out there, with the exception of some parochial schools, have the 6-foot distance. They've figured out ways to make sure that the kids can stay 6 feet away from each other. All of them are mandating masks, which need to be mandated. And, it's like with anything, though, it's not the plan, it's how it's operationalized. So if they can do that, they will be able to prevent outbreaks in the schools. You cannot prevent cases from coming into the school, whether it's on students, teachers, or staff. But you can prevent outbreaks by doing the distancing, and the plans are pretty solid for that. So that's what we're banking on, that everyone will be able to stick to those plans.
Well, we're relieved that the kids aren't doing face-to-face. However, I'm very concerned about the kids that were getting free and reduced lunches, which at my son's school, I know that's 40% of the population. Is public health involved in taking care of those the vulnerable population of the community?
Well, the schools, first of all, are still continuing. If the kids are learning remotely or whatever, they're still figuring out how to get the kids food, the lunch and breakfast. And then, certainly we have a lot of food pantries in town, including the one here, our drive-through that we have every Thursday. So, we're trying to make a lot of referrals out there. And we're even here at Public Health, we're even looking at the ability to continue the summer food program right on through, fall. So we're looking into that. And I know if that is allowed, then that'll be done in a lot of places, not just here. So that would be helpful to families as well.
Let's go back to statistics for a second. There's a lot of arguing about the cases that are active, the cases that were recovered. I might be recovered, but that may still mean that I'm on oxygen or I have blood clots now. Can you sort of clarify the statistics of how we count the cases?
Yeah. So a case, and there is a lot of confusion out there. So a case is someone who has tested positive for COVID-19 through a CLIA certified lab. So these are not any of the rapid tests. These are not antibody tests. These are showing active infection. So those are the only ones that are counted in the number. And so in the United States, you will see that's up around 5 million at this point, which is completely staggering to me. But those are the only numbers counted. I've heard so many weird things about people just apparently guessing how numbers are counted, but that's how it is. These are reportable diseases, and there's laws on how they have to be reported, and it only comes from the lab. It's not somebody calling and saying, "Oh, hey, I have COVID." So these are lab confirmed reports, and if somebody were to test positive today, and then for some bizarre reason we go and test 10 other times at the mall tomorrow, those don't count. These are individual cases, so they're matched up, and they're not duplicative cases. They are actual cases. So we right now have 153 active cases in 153 different individuals, all with COVID. So with those 153, there are probably, I don't know the exact number, but several hundred who are also in quarantine associated with those cases. And that can be family members, that can be, whoever they live with, that can be somebody they ride to work with, that can be their coworker if they're not social distancing at work. So that's what we are. That's where we are right now.
And I have to commend the University of Illinois for having it be so accessible and a quick turnaround for my friends who are academics over there, for the incoming students. But let's talk about the incoming students for a second. We are about to have at least 30,000 people from all over the world descend upon a town our size. Does that not completely stop your heart and make you a little bit nervous about what's going to happen over the next month?
It doesn't, actually. I'll tell you why. It's because we've been involved, with the planning since the beginning of this. So we know all of the multiple layers. I mean, it's just, testing and tracing and internal rules. It's just a whole net of services that are there to prevent outbreaks. So it's what we're going to be looking for is not the number of cases, because we absolutely expect cases to increase when people come in and get tested. What public health is excited about is the idea of, the really rapid turnaround time. That's what we would like to see everywhere in the United States, and certainly in the countries that have gotten past this or have, done really well. That's it. It's their testing and tracing game. It's your basic public health measures that have made it that way. So the U of I has all of that in place. So, honestly, they're going to be if people are coming here from other countries, that's probably more scary to them than it is to us, because a lot of other countries are doing far better. Our state is doing pretty well overall, so there are definitely hotspot states, but as the students come in, they'll be tested, and then if they have it, they will be isolated, and anyone they may have been in contact with at that time will be put into quarantine. So, while we definitely expect to see a huge spike in the cases as they come in, which will require a lot of, work for the 2 weeks that they're in isolation, we hope not to see any spread from that, because they're coming in, they're getting immediately tested, and then they're going to go into isolation if they're positive.
Before I ask this next question, I want to full transparency. You and I are long past the age of bar hopping, but the growing number of cases of 19 to 30-year-olds is increasing. Bars seem to be an epicenter of the virus. Why aren't we closing bars?
Well, it's not that simple, for one thing, because if we close the bars, if you can stretch back into your memory bank like I can, before we could get into bars, we were still managing to find ways to party. That's for sure. So kids are going to do it if they, you feel a certain invincibility when you're young like that. And they also know that while they can have negative outcomes, the vast majority of them won't. So they're closing the bars could push them to other places, other bars outside of, our county. That's less likely than like house parties or things like that, where it'll be difficult to get a handle on it. Because it doesn't matter if there's, 10 kids all in an apartment together partying, or 100, they're all putting themselves at risk doing that. Even if they're just sitting in there and they're not partying, it's the gathering, it's the time, the distance, and space. So one thing about the bars is you can keep a better eye on them, in the sense that, you can have some rules set up for that. Would I like to see everything shut down for about 3 weeks, just in general, not shut down, but maybe go back to phase 3? Yes, and we would definitely like to see that. And we're looking into ways to do that, because that will give, that'll kind of give us a chance to reset. Schools will be in, the U of I will be here. We'll kind of try to tamp everything down and let those cases play out, and then they'll all be in isolation, and then hopefully that will prevent a lot of major outbreaks. But a lot of this that we've seen this summer, I mean, there's certainly some bars, but there's also just a lot of gatherings. I keep saying this over and over, but it doesn't matter who you're gathering with. It doesn't matter why you're gathering, just that you're gathering. So, if you're all hanging out together in the lunchroom at work, that's a gathering, and there's risk for exposure. If you are going to a birthday party for your grandma, that's also a gathering. If you are, whatever you're doing, you still have to maintain that 6-foot distance and wear masks. You just have to do it to prevent exposing anyone or being exposed.
Let's say I am at a gathering and I later find out that somebody there tested positive for the virus, and then I go get tested, but I'm negative. Do I still need to quarantine for 2 weeks or the allotted amount of time?
Well, if you need to be in quarantine, you're going to be put in quarantine by public health. So let's say that you're at a gathering and you have been in, the person mentions that you've been in the gathering when we do contact tracing, and you've been around them, 15 minutes within 6 feet. Public health will put you in quarantine, and it'll be for the full 14 days. You can't test out of quarantine. The reason why is because the tests still have a 20% false negative rate. Not false positive, that's completely different, false negative rate. So that means it could be missing 20% of infection. So if you're exposed, you're going to be in there for your entire incubation period.
I'm glad you brought up false positives and false negatives. The governor of Ohio tested positive for coronavirus and then 2 subsequent negative tests. Are we seeing more false positives or false negatives?
I'm so glad you asked this. This is such a good question. So the governor tested with one of those rapid tests that I'm talking about that are basically worthless. There are, that's what the White House uses. That's what other places use. It's a rapid test. So you get your results in 15 minutes. The problem is there are both high levels of false positives and false negatives. So you would literally be as useful to flip a coin. So none of those tests are counted in the case counts, none of them. And for just that reason, it's considered like a screening test, but it's still not a very good one at all. So none of those count as a positive test unless it's followed up by the actual PCR or the antigen tests that are being done in CLIA certified labs. So it's important for people to know that that was just a screening test and it was not counted as a positive. It really shouldn't even be called a positive case because those screening tests they don't count.
Okay, I'm glad you brought that up again because the president and the administration keeps saying that we're only getting more positives because we're doing more tests. But logically, I'm thinking that we're getting more positives because we're doing more tests because the virus is there. We're just sort of confirming the test. Am I getting that wrong?
No, you're not. I mean, this is another one of those really frustrating things. Why we know that it's not just a mechanism of testing, more testing and getting more positive test results. What we're seeing is high positivity rates in those tests. That means that yes, we're doing lots and lots more testing, but the positivity rate is still up there. We're still seeing lots of positives coming in from those tests as a percentage of those who have tested. So it's not just, that's part of the problem is that, everybody out there all of a sudden is an epidemiologist, and they're just constantly throwing out their weird interpretations of the data rather than just listening to the super simple things that people are trying to tell them to do to prevent this. But no, that's just not the case. If there's a lot of virus in our country right now, a staggering amount, and the deaths, the numbers of deaths are not acceptable. And you can see that these cases are doubling, at a much more rapid rate than they were. So, and I said this a long time ago, it's a very difficult concept for people to understand what exponential growth looks like in cases. And that's exactly, what we're seeing places. So it's frustrating and it's really sad, but we're moving forward and luckily we do have a lot of access to testing and quick turnaround times in Champaign County. I just wish we had that everywhere.
I know you can't speak for other communities, but would you say we're doing an equitable job of taking care of marginalized communities in testing and taking care of those more vulnerable?
Yeah, here's the issue with that. So, normally what public health does is that we look at the stats where, like we did this with H1N1, you look at the stats, who's getting the vaccines, and then you make sure that you get to the neighborhoods where there are gaps. And we know where traditionally we will see less access to service. The problem with this is public health is not in charge of the testing. So we have a community-based testing site, which is great. But what I would like to be able to do is like pinch off a couple of hundred of those a day, or even 100 of those a day, and start doing mobile pop-up sites with those in communities where we know that there's not as high of an uptake of testing. So that we would really like to do, and we've been working with both the community-based testing site and Carl's lab and the U of I even to see about the possibility of doing that moving into fall, because I would like to see a couple things. One, I would like to see our testing sites be, keep the one at the mall, but also have one, a smaller one that rotates from, the northern part of the county, southern part, east and west, and just a week at each place. That would help get people from the more rural areas to have quicker access to testing, but it would also help pull in the smaller counties around us where we know there's an under testing going on.
Would you say that some of the jail populations, as well as people living in homeless shelters, are at a greater risk as well?
In general, absolutely. Anytime you have congregate settings like that, where people are overcrowded, it doesn't matter where you are. I will say, though, locally, I know that the shelters have done a great job with help from, like, the Champaign Park District, for example, helped early on to make sure that our homeless shelter was expanded by using one of their gyms so that there wasn't any, outbreaks going on there. And with our jail, they have enough capacity that they're able to test people as they come in and also put them in quarantine for 14 days and then in with others. So, once you do that, like I said, you can never prevent cases from coming in, but you can prevent outbreaks. And I've been really proud of all of our congregate living facilities in our county, from the shelters to long-term care to, every place has been doing a really good job.
As long as I've known you, I know nothing would make you happier than 100% community compliance on flu shots. They may be 50 to 70% effective. However, we know it helps with herd immunity, and it is the smart thing to do. Do we have any reason to believe that COVID will be about the same effectiveness as the flu shot? And obviously, those of us who believe in flu shots will also get COVID shots.
Yeah. Well, that's another really good question. There's a big difference between the COVID, the coronavirus, and the flu. So influenza is a virus that mutates really rapidly, and that's what happens when we see the flu shots not being as effective. Usually what happens is the flu vaccine is made from what's going on in the southern hemisphere, and then it mutates somewhat. It evolves to, at least one of the strains evolves a little bit so that it is not, the flu shot's not a perfect match. It still helps. It absolutely still helps to get those flu shots. So it'll help with that, but it will also help with the other strains, because people can get more than one type of flu a year. You can get an A and a B, for example, or even two different A's and a B. So it's very important to continue taking that, and it's just like with anything, that vaccine is not just protecting you, it's protecting those who can't take it or who do not have a good, robust immune response to it. But with COVID, we don't really know. There's all kinds of vaccines out there that are, moving towards the testing phases. So we don't know what the mechanism is that will give the immunity or stop the spread of this. We don't know yet which one is coming out, but whatever it is, it will be different from the flu in the sense that this virus is not expected to just rapidly mutate like that.
Last question before I let you go. I quote you often, and I quote Dr. Fauci. I would say in the last 5 months, I've probably quoted the two of you more than anyone. Dr. Fauci says he'll repeat the importance of public health principles, quote, until I'm exhausted. Can you put his sentiment in your own words?
Yeah, I am exhausted, and I'm continuing to say the same thing. I feel, sometimes I feel like I'm in the twilight zone, because what we can do to stop this spread is so minor. It is, they do work. It's masking and distancing. And while we can't, while, it's turned into a bizarre political and I don't even know what, it's more than that. It's just like a science versus not science, science versus magical thinking. I don't get it. And yes, we can save lives by doing something as simple as wearing masks and staying away from people. And this will end. This pandemic will end. But we, through our own behavior, are dragging it out. We're dragging the economy down. We are causing all of these problems due to our own behavior. All you have to do is look at the countries that did a great job on this, and you will see how they did it. We can't individually do anything about the mess that is testing. That needs a federal response. We need way more testing in this country, but we all have the ability to do the very simple things that we need to do. We need to wear masks, stay 6 feet away from other people, wash our hands, and please get the flu shot, because all of those things are going to protect our healthcare system moving into the fall and winter. And yes, I will continue to repeat that. You've heard me for 26 years repeating get a flu shot every year, so you know I have no problem, and I have kids, so I'm used to repeating myself. But yeah, that's really what it's going to take. And our community does a much better job than some communities, but we all need to do that, and we need to quit being so ridiculous about it and so hateful to each other. I mean, I've heard people yell at somebody for wearing a mask. I don't even get it. So here's an idea: zip your pie hole, put your mask on. That'd be great.
Okay, you and Fauci have the final word. I also want to thank one of your community partners in this, Urbana Mayor Diane Marlin. She's been great at spreading the word as well. Every time I've seen her, she's in a mask. Also, Jason Liggett, our producer, UPTV, we couldn't do this without you. Julie Pryde, zip your pie hole. I like that. Please unzip yours until the pandemic's gone. Administrator, Champaign-Urbana.
My pie hole doesn't zip.
Leave it unzipped. Champaign-Urbana Public Health District Administrator Julie Pryde, thank you so much for your time today.